Heard there's a bunch of new nurses coming today. Let's get them. Yeah. What do you want to do? Yeah. So excited. Today is my first nursing shift. I am all ready to go. I have my cardiovascular emergency book just in case something goes wrong. I've got it all, got all the knowledge up here. I'm ready to go. So excited. How dare these new nurses come to our unit where we had to work so hard to even get a good shift, and they just get to come in here and get whatever they want, the hours that they want, whenever they want them? That's bull. Do nurses eat their young? I hear this concept flying around a lot. And I was trying to remember, did I actually hear this in nursing school? And I don't remember that. But I certainly remember it when I was orienting as a new graduate nurse to a new unit. I was kind of experiencing it. So in this video, I'm going to share with you some of my own experiences, as well as some tips and tricks, and specifically some communication tools that can help you flip the script on what is happening here and change your mindset about the whole thing. So maybe this bully can act however they want, and it doesn't have to affect you, your career, your personal life, or your home life. Let's get started. For those of you new here, I'm Dr. Lisa Chappell. I'm a doctor of nursing practice and associate professor and studying to have my board certification as a health and wellness nurse coach. I make videos for nurses, students, and caregivers on accessing your inner resources to become more empowered and resilient. Hit the subscribe button if that sounds like something that you'd like to learn more about, and give me a like. It really helps me out. And also click that notification bell. I do release new videos every week on Wednesdays. So what is this concept of bullying or incivility in nursing? First of all, these are my thoughts about it. I believe that bullying occurs in every industry. My husband worked in finance for decades, and he would tell you that was rampant all over the place, that the new recruits would come in and they would haze them and bully them, or there was always that sense of competition, getting ahead, and so there was a little bit of bullying. But I think in nursing, because nursing is seen as such kind, compassionate, caring profession, that it's shocking when it occurs within nursing. That can give new graduate nurses or student nurses a lot of trepidation about going into this profession, about doing their clinical rotations, and then about starting within a profession where it's meant to be kind and caring, but then it's not. So I have some tips for you, which I hope will help you out on how to respond externally and how to prepare for that response, but then also how to respond internally and use it as an opportunity to really approach your own thoughts and your own feelings about it with some inquiry. Another term for this bullying that occurs in nursing, lateral violence. Violence, I mean, that sounds really extreme, but it's basically a sense of a lack of autonomy, a lack of control, and the need to push down others so that a person could feel more elevated. It's really an immature response. Unfortunately, the statistics show that it's very prevalent and very common within nursing. So why is bullying common within nursing? I think some other reasons besides feelings of lack of autonomy or feelings of lack of control and power, there's a sense of competition that's really established early on within nursing. And that's within a lot of fields. So nursing isn't unique in this regard, but it's kind of a cutthroat environment right into nursing school. It's difficult to get in. Nursing school is really difficult to survive. Some nursing schools, I think the students are set up with the expectation that it's like, look to your left, look to your right. Only some of you are going to make it through this program, or only a few of you are going to make it through. So it's this sense of competition that's set up really early on. Or nursing students are really, especially in accelerated nursing programs that I've noticed, that nursing students are really motivated, type A people, and they're wanting to get ahead. Their goals are really to elevate in the profession. Some high intensity areas that are difficult to get into because there's limited spaces for them. And this creates a sense of competition really early on that carries through. Another reason that nurse bullying exists, I think, is because tend to give and give and give until there isn't really many reserves left. And so then there's the sense that, well, I need to take from others in order to fill myself up. It isn't right. Part of the reason that I have this channel is to help nurses before they get to that point where they feel like they have to dominate other people. Make sure that you can continue working while filling up yourself so that you don't feel that you have to go and hurt other people or take from other people in order to get what you need. All right, so some facts about bullying. The definition of bullying, according to the American Nurses Association: repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. So in taking a look at this statement, I have to ask myself, in the incidences of what is perceived as incivility and bullying, was it really with the intent to humiliate, offend, and cause distress? And I have to think about this one a lot. It has been my experience with 20 years in this profession that this just isn't true, that the majority of people, or even the majority of these circumstances, are because somebody is trying to humiliate or offend someone else. I think in the majority of circumstances that there are underlying things that are going on that maybe you can get to the heart of that a little bit better. I don't know, tell me what you think. Put in the comments below. Have you had experiences that are similar, that you feel like most nurses are good people and there's just other things going on of why they would choose to be mean to their peers? Or do you really think that they're just mean people who shouldn't have gone into the profession in the first place? What do you think? I'd be really interested to know. Let's start a discussion in the comments. So there definitely are people in every profession who do intend to cause humiliation for whatever reason, and that kind of gives them their fix. We'll talk more on how to handle those types of situations and these types of people in a little bit. Some of the statistics, apparently up to 60% of new graduate nurses leave the profession within the first 6 months because of some incidents of abuse or harassment. And that statistic is quite staggering if you think about it. And that's not what we want within the profession of nursing, because there's this impending shortage of nurses. And so it would actually behoove nurses to embrace and accept the new generations of nursing that are coming in, rather than to exhibit this lateral violence or to try to push them down in order to elevate. So my experience with bullying, when I was a brand new graduate nurse, and I did go through an extended orientation program because I worked at a magnet hospital. And so we got up to a year long of mentorship and precepting, which was amazing. After my 3 months one-on-one with a preceptor, I was ready to be released and go work on the units. And I remember within that first week coming to work one day and looking at my assignment. Who are the patients I'm going to be taking care of today? What? Okay, what? Admission? Okay, I can do an admission. I did that with my preceptor. I can do it. Discharge too? Seems like a lot. Okay. Surgery? Spinal surgery? Oh dear. And 3 other patients? Seems insane. No, this can't. Excuse me, today's my first shift. What? And I have an admission, and I have 3 other patients, and whoever was there first would create the assignments. And it seemed overwhelming to me. I didn't think that this was something that I could handle. And I approached the nurse who had set up the schedule, and what she said to me was, "Honey, I think you can handle it. I heard you're really smart, actually, and I think you can handle it." And looking back, there's just so many different ways that I could have handled the situation, but didn't use the tools that I'm going to talk to you about. Maybe I should be able to handle it. I should be able to do this, right? I don't know. Okay, I guess I guess I should do this. I don't know. I'm not meant to be a nurse. I'm obviously not meant to be a nurse. No. I quit. I'm quitting this job. I should be able to handle this. I should be able to handle this. Everyone else can obviously handle it. Why can't I? Clearly, I should be able to handle this. So I'm going to give you some tips and tools on how to both internally and externally manage the situation if you feel that you're experiencing bullying from other nurses or other people or incivility. All right, first I want you to think about the situation. And this might be long after the situation has happened, because sometimes you don't know how to respond in the moment to these kinds of things, because it can be shocking when someone just says something really rude to you, or it feels like they're doing something to you to try to make your life more difficult. Once you've been able to sort of distance yourself, maybe you've had a couple of days off, and then you're just gonna sit down with a journal and write about the situation. Write out what happened, write out the thoughts that you were thinking, the emotions that you were feeling. What did it bring up for you? The beauty is when you're writing in a personal journal, you can write whatever you want. So you're not gonna bring it to work then where it could be found. This is for you at home. Just vent. What I want you to do in the moment is to, first of all, refrain from reacting negatively or reacting with anger if you can manage that. The other thing I want you to avoid doing is going to your colleagues about it. And so being like, well, does she usually mean like that to people? Does she usually treat people like that? Is he usually like that? Because just engaging in that kind of gossip with others is going to reaffirm your negative viewpoints of the situation and kind of cause you to have to live it over and over again. So I really encourage you just to refrain from that. First, you're going to journal about it. You are going to take action on the situation. Calm yourself down, take a deep breath, maybe go outside for a walk. Do what you can to not react in that moment in a negative way. And then also refrain from going to discuss this situation with other people. So after you've had some time to write about the situation and really identify the thoughts and the feelings that came up for you, you are going to take action. And this is really, really important because it's going to set a precedence for yourself that you're going to stand up for yourself. You're not going to tolerate being treated in a negative way. And I have some tools for you on how to do that. The first tool I'm going to share with you is with an advocacy-inquiry strategy. I can't take credit for this strategy. This comes out of the Center for Medical Simulation at Harvard University. Jenny Rudolph, Robert Simon, et al. Created this strategy to use during debriefing after a simulation. Someone who's observing a simulation situation could give feedback for that other person. But this strategy works beautifully in all kinds of situations. So what it is, you're gonna use an advocacy inquiry using I saw, I think, I wonder, okay? So I saw, you're gonna describe the situation that you saw and how you see it. I think, you're gonna say what you think about the situation. Two things that you're advocating for yourself. But then you're gonna get curious about the situation and you're gonna ask the other person about their point of view, okay? So I saw, I think, I wonder. And you can start it off with, hey, I'd like to talk to you about patient assignments today. Tell them what you saw. I saw that you gave me 3 patients plus an admission, 2 discharges, and a surgical patient. This is what you saw. Then you say what you think about it. I think that that's extremely unfair and that the assignments should be distributed more equally. I also think it's inappropriate for a new graduate nurse to be having this assignment. The inquiry is that you get curious about it and you talk to this other person. So you're saying, what do you think about that? Or can you tell me what was going through your mind when you made that assignment? Tell me what you were thinking in that situation. So you're getting really curious about it. Excuse me, Amanda, when you have a minute, I'd like to talk to you about the other day and the assignments. So when you have a minute, can we sit down in the break room and talk about this. Yeah, I have a light load today. I could come talk to you in the break room about it. Sure. All right. Amanda, thank you so much for talking to me about this situation. I would like to talk to you about the assignments that you made the other day. I saw that you gave me 3 patients in addition to an admission, a discharge, and a surgical patient. I think that this was not an appropriate assignment for a new graduate nurse who's just coming off of orientation. And I was really wondering what was going through your mind at that time and to understand it. Well, here's what was going through my mind. I was the first one here, and so I put together the assignments. I wasn't intentionally trying to slam you, but I thought that you could pick up the load just a little bit. But now that I think about it, you're right. It was a little harsh what I did, and I'm sorry. Maybe part of me was trying to punish you a little bit because I thought that you should be able to handle it a little bit better. And so I'm really sorry about that. What I like is I think you're kind of good at putting together assignments. Actually, I think you're a lot better at putting together these assignments than I am. And so I'd love it if you would just show up like 15 minutes earlier and then we could put the assignment together ourselves. I mean, you could help me with it. I think that'd be great. So then once you've used your advocacy inquiry, you're just gonna listen and you're gonna hear what the other person has to say. A lot of times it might not be what you expect. That sounds good to me. All right, well, thank you. I really appreciate you coming to talk to me about this. I wouldn't have known that you were so upset. You seem like so able to handle it. You're gonna be good on this unit. I think you're gonna be really good. You're gonna be a real asset to us here. Just confronting this situation in this way, in a one-on-one, is gonna do a few things. First, it's gonna show how professional you are, that you didn't go gossip with other colleagues about the situation, that you didn't react in anger at the moment, but that you took some time and now you're approaching the situation to advocate for yourself, but then also to be curious and inquire about what that other person, where they were coming from, what is their perspective. And this can really help you to make a great impression on not only this other person, if they're a kind, reasonable person, but also on the entire unit. So this is definitely what I would recommend as your first step after you've had some time to calm down and get in your right mind about it, to use an advocacy inquiry. You'll get better and better at this as time goes on, and you'll be able to use it even more effectively. If advocacy inquiry doesn't work for you, and this may be because this person really is a bully, they really do want to offend and humiliate you, and they're looking for some kind of reaction from you. The thing about bullies is they get their fix by seeing you react. And so if you flip your lid, they love it. And it just gives them more fodder and they're gonna keep coming after you. It may help you to use what's called the gray rock method, which is where you have as little response as possible. You just go completely gray rock with them. And you're gonna act like you don't care what they do, what they say. That's another option for you that can be helpful. The problem with it is that it may cause you some distress when you're trying to be yourself with your other colleagues or trying to be yourself on the unit. And so it's really not for every single situation, but it could buy you time until you're able to escalate the problem to a different level. If none of this has worked and this situation is still bothering you, you can always take it to management. And I think it used to be the case where this would get kind of brushed off by management, but it is becoming more and more of a problem that management and leadership is more and more aware of. It is likely that they're gonna help you out. First approach, I probably would stay away from keywords like bullying, incivility, lateral violence. These are red flag keywords that will definitely get the attention, but I would probably save them until you're approaching the situation just a little bit more delicately. And maybe it's just that you need an advocate. You need a person on your side. Likely leadership may bring you and this other person together and facilitate some kind of a happy medium. However, again, as I said, if this person is truly a bully and it is their intention to cause issues, this may make it even worse if the leadership wants to facilitate a situation like that. So if you suspect that this person truly is a bully, I would not recommend meeting with management and with them to discuss the problems. I would just escalate it immediately, talk about the issues that you're having with management, and ask them for some help. More and more, this toxic culture, managers and leadership are aware of it, and it is likely that they're probably going to help you deal with it because usually it's not tolerated at all. So if you're in a situation where there is a safety concern, kind of like the situation I was in, it wasn't smart for me to just assume care of 6 patients with admissions, discharges, and surgical patients. That wasn't safe for me to take on that patient load. What I could have done is use what's called the cussin' tool. So you're gonna go in cussin'. That stands for I am concerned, I am uncomfortable, this is a safety issue, I need you to rearrange the assignments. So that's the cussin' tool. Concern, uncomfortable, it's a safety issue, and then you're advocating for what you need to see happen in that situation. Which, since you're caring for people and people's lives are kind of in your hands, it's a good idea then to go ahead and to advocate in that issue so that it doesn't cause a safety problem. Okay, so let's talk about some of the internal management that you can do. And for this, you're gonna come back to your journal and look at the thoughts that you had and look at the feelings that you had in that situation. And you're gonna use that inquiry to question your own thoughts and maybe your own feelings. They are valid, but you're gonna use some inquiry and try to detach a little bit from those thoughts and feelings and ask yourself some questions about them. In this case, you're asking, is there some belief that I'm holding about myself that is making the situation worse or making this person feel like they can take advantage of me because I somehow believe that I'm inadequate or that I have this imposter syndrome and that I'm not capable of doing what I think that I need to do? So you're really gonna start asking some questions. And what I would recommend in terms of a tool is look at the work of Byron Katie. She has this amazingly simple strategy for asking questions about our own thought and then turning them around. So in this case, you're gonna ask yourself, and maybe I've come to the conclusion after doing my advocacy inquiry, using some of these safety tools that Amanda doesn't respect me. And so I'll write down this thought, Amanda doesn't respect me. And then I'll ask myself, is it true that Amanda doesn't respect me? And maybe I see a lot of evidence that she doesn't. I might say, yes, Amanda doesn't respect me. But then you're gonna say, can you be absolutely sure that it's true? Can we really be absolutely sure of anything? Not really. I can't be absolutely sure that Amanda doesn't respect me. Then I ask myself, what are the feelings and how do I respond when I think the thought, Amanda doesn't respect me? And maybe I feel it in my chest and I feel it in my throat and I just feel sick to my stomach that Amanda doesn't respect me. Well, then you ask yourself, who would you be without this thought? Who would I be without the thought that Amanda doesn't respect me? I would feel free. I wouldn't care. I would advocate for myself and Amanda could do whatever she wants and I wouldn't have to care about it. Then what you're gonna do, and I think this is really a powerful piece of this inquiry, is you're going to turn it around and reverse the words. And so from Amanda doesn't respect me, a reverse might be, I don't respect Amanda. And then you might think, how is that as true or truer than the original statement, Amanda doesn't respect me? And I may think that actually I don't really respect Amanda because I feel like she's taking advantage of new grad nurses. And I feel like she's mean. So no, I don't really respect Amanda. Then you might ask, or turn it around again, I don't respect myself. And that might be kind of eye-opening. Do you respect yourself? Could it be true that you don't in certain situations, or that you have thoughts that are disrespectful about yourself? Like, I can't do this, but I should be able to, or something like that. If you take that thought then of I don't respect myself, and you go back through those questions, is it true? Am I sure it's true? Who would I be without it? What feelings does it bring up in me, and who would I be without it? Then it's, I do respect myself. It can be a really, really powerful way to uncover what's really going on inside of you. Then you may get to a situation and a point where you just really don't care anymore. And it can be really freeing to help you internally be able to manage bullying so that you don't have to carry that into your life with you and feel inadequate or believe some of these lies really about yourself. Some other things that you might do is really examine, okay, what are my actions? If you come to the conclusion, no, I don't respect myself in this situation, then how could you show respect? Do you know maybe that you're not showing up fully, that you're not doing what you could in the situation? And really think about it very honestly. Is there more that you could do? Can you? How can you get the resources to do that? And how can you just be really aware of your own actions and your own responses? All right, do you have any other tools that have helped you? Comment below, would love to hear about them. I love communication tools. They are so helpful. Thank you so much for watching. If you found this video helpful, please give me a like. It really, really helps me out. Click the subscribe button below and click that bell for notifications of when I release new videos, because I release them every week. See you next Wednesday. Hey, if you've made it to the end of this video, give me a purple heart in the comments, will ya? That'd be great. Thank you. She is a nurse now. She's supposed to be able to do what we all can do, right? I was the first one here, so I did the assignments. I get up early, I come in early. If other people want the assignments done differently, they should get up early, okay? That's what I think. You do the assignments then.